Good morning, everyone, and thank you so much for joining us today. I'm Vicky Sturgeopoulos. I'm Vice Chair of Clinical Programs and Innovation in the Department of Psychiatry at the University of Toronto, and the Physician-in-Chief and Clinician Scientist at the Center for Addiction and Mental Health. It is my great pleasure to welcome all of you and to introduce Dr. Nikhita Singhal and her presentation. I would like first to begin with the acknowledgement of the land on which we work, study, and live. We recognize that many Indigenous nations have long-standing relationships with the territories upon which the sites of the Department of Psychiatry are located that precede the establishment of the University of Toronto. We acknowledge our presence on the traditional territory of many Indigenous nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples. To date, the land is home to many diverse First Nations, Inuit, and Métis people, and we are grateful to have the opportunity to live, work, and gather on these territories. We acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty, signed with the multiple Mississaugas and Chippewa bands. Today, it's my pleasure to introduce Dr. Nikhita Singhal, who will be speaking about how her experiences as a patient have informed her approach to psychiatry. Nikhita is a third-year psychiatry resident at the University of Toronto and completed her undergraduate training and medical training at McMaster University in Hamilton. Her desire to pursue a career in mental health was sparked by her own experiences as a patient, and she hopes to harness this to work towards addressing current challenges in the system and enhancing the care we can provide to those who are struggling. She's passionate about engaging in advocacy work, striving for patient empowerment, exploring the humanities, and melding clinical practice and research. Her specific areas of interest lie in within psychiatry include psychedelic science, addiction medicine, eating disorders, psychotherapy, and working with child and adolescent populations. We are thrilled to have Dr. Singhal today with us, and so please join me in welcoming her.
Thank you so much, Dr. Sturgeopoulos, for the introduction. And it's a true pleasure and honor and privilege to be here today, speaking to all of you. So welcome to my presentation for Mindfest 2022 on personal experience driving change. And so to begin with, who am I and why am I here today speaking to you? So Dr. Sturgeopoulos kindly provided that bio, and I guess to give you a sense, so I'm a third-year psychiatry resident who's studying here at U of T. I've been very fortunate in that. It's my passion, and I'm also, in addition to being a trainee and hopefully a future healthcare provider, somebody who has had experience on kind of the other side, and that's really what spurred me to pursue this profession. So I'm patient and provider, and so that's kind of why I'm here speaking to you today. And I'll be perfectly honest. I'm not a celebrity. I'm not a leader in the field. I don't have a laundry list of accomplishments or achievements to my name. And frankly, I'm terrified to some degree to be here in front of you all and feeling totally unqualified. I mean, you may have heard of imposter syndrome, and we've got a comic up here kind of alluding to that. And I'd say that's just about the only thing that I am an expert in, to be honest. But what I do have is a story. I'm not unique in having a story. We all have stories, which is part of what really drew me to the field of psychiatry. I mean, as a kid, I often had my head buried in a book. I loved to read and to hear stories and to really just become ingrained in a whole nother world. And I really love that this specialty, psychiatry, allows us the privilege of listening to people's stories and playing some small part in a chapter of their lives. We are fortunate in having the time to explore what shaped people into who they are today and to empower them to change their narratives moving forward as they strive for health and well-being. So where does my story begin? I was born in San Diego, 1995, but let's skip forward a few years to when I was 7 years old. At that time, you can see me up there. I was a pretty healthy, happy kid, and I lived with my mom, with my stepdad, and with my grandmother. And I was in the 3rd grade at a pretty small school. Things were generally good. And looking back over the years, one of the things that we do in psychiatry is we try to really, we call it a biopsychosocial formulation. We're trying to envision like what it is that led to someone struggling with what they're struggling with today. There's biological factors such as genetics. There are psychological factors in terms of the ways that we think based on our experiences growing up, and social factors, things like my parents, for example, were divorced. And for example, I was bullied in school. And so we think about how all of those different things can contribute. By and large, at that time, I didn't know where my life was going to lead. I didn't know I was going to become sick. I was, for the most part, I started to become a bit anxious, and I started doing some things that now looking back, like I was diagnosed with obsessive compulsive disorder. So a lot of kind of like tapping and counting and different behaviors like that started to receive attention from people because they were unusual. And another thing that I started to do, and to this day, I really don't know why it is, I began to stop eating. And so it wasn't at that time because I had body image issues. I didn't have a desire to lose weight from as far as I can recall. But one of the things that people talk about when it comes to eating disorders is that one of the theories is that it comes from maybe feeling a lack of control over your life. And so one thing that we can control is what goes into our body and what we're eating. And so I'm still exploring kind of what it is that may have led to things, but that's one thing that comes to mind is maybe there were some chaotic things happening in terms of like, again, the bullying and with my parents and having like all kinds of different things, some losses, people passing away. But there we are. That's kind of where the story starts. So next stage of things, kind of take off. So this was my first real encounter then with the healthcare system, aside from seeing my family doctor for checkups up till then, was when my family physician became initially concerned because I had stopped eating. And I was really starting to kind of fall off of that growth curve. And there were also the other behaviors going on. So she referred me to a pediatrician, kind of more subspecialized, who maybe would be able to help sort out what it was that was going on. And they then recommended the pediatrician that my parents take me in for a consultation at a hospital. And at that time, eating disorders were typically seen in people who were more adolescents. Now, unfortunately, it's becoming more and more common for kids, as young as 7, younger than 7, to be really diagnosed with and seen with these illnesses. At that time, it was more unusual. And so we went to the hospital, and we were all quite shocked and taken aback. We thought it was just kind of, let's get a sense of what's going on, let's figure it out. They put down a plate of food in front of me, and they urged me to eat it, and I refused to do it. And I was very stubborn. Looking back, I think there are lots of times where I wonder what would have happened if I'd really just been able to for that moment, put aside whatever it was that was driving me not to eat and put something in my mouth, maybe I would have been able to go home. But what happened instead was that I was admitted immediately, actually, to their inpatient unit. It was a real shock for all of us, and that was the beginning of a very, very challenging series of encounters within the healthcare system. And I think that, again, people had good intentions. They wanted to help. There was kind of a sense of not knowing how best to do so. And again, it was unfamiliar at that time for someone so young to be seen with this kind of an illness. And that may have played a role in their decision. There's the concepts of like being medically unstable. And I mean, at that time, though, one of the things that really had an impact on our family was that they were essentially threatening that if I wasn't admitted, then they would kind of call like child protective services, and that I needed to be, because my parents, that wasn't what we'd gone into that day expecting. We thought we were going to go home. We thought we'd maybe find out a little bit more and begin to learn, but all of a sudden to be taken out of my life and put into a hospital, it's kind of terrifying. So at that point, I was admitted, and so began this journey. So that at that time, that was in 2003, I had just turned 8 actually, and it was 5 weeks that I initially spent there in the hospital. And it was really, I mean, my parents were terrified that failing to put me in the hospital would harm me further. And they also could see that it really wasn't helping being in the hospital. They actually, they allowed my mom to stay with me on the unit because I was so young. And it was still quite scary. There was a lot of the patients were much older. There was one other patient who was my age, but the things that we saw and the things that we went through were really, really, really traumatic in many ways. And again, with the intention of helping, and also things that are intended to help can also hurt. So I think the focus really during that admission at age 8, when my parents ultimately did end up taking me out against medical advice, but they could see it wasn't helping and agreed that I'd follow up as an outpatient. But the focus at that time was really on weight gain and nutrition, which makes sense. Somebody who's struggling with an eating disorder, and if they're underweight, then you do want to make sure that they are healthy and physically take care of things. But I found that really over the course of the treatments and experiences that I've had, and that being kind of in childhood, so I was hospitalized then. I did a lot of outpatient treatment. I've done many different kind of settings, and over, the focus has been kind of, you get what they call weight restored. They will focus on the feeding. There's feeding tubes, and again, that can be a traumatic experience as well, having like a kind of a tube inserted into you, and when you're not really wanting it, and people may be put into restraints, and it's challenging. And I saw other patients struggling. And one thing that really, like one experience that really just sticks with me is I was speaking to a nurse at one point who had been kind of on one of the units for many years. And she said, it's a revolving door. It's so sad. People will come in and they will get kind of fed and then discharged, and then they're back, because kind of the underlying issue, you'd see the same patients coming in over and over again and then relapsing once they left the hospital and weren't being forced to eat. And I saw that pattern for myself, many of my co-patients, and kind of each encounter then with the healthcare system ended up pushing me further into the illness and instilling a sense of mistrust and frustration with the treatment itself instead of with the illness. being punished for kind of engaging in things that resembled physical activity. If our leg was shaking, we were trying to burn calories. And so you would then be kind of punished in a way with more food. And again, it was in the interest of, oh, if you're burning energy, you need to make up for it. We need you to be medically healthy. And people had good intentions again, but it felt very, very challenging and traumatic in ways. And sometimes labels are applied, being manipulative or treatment resistant, and when you're not getting better, and that can take a toll on people kind of emotionally as well, and you begin to believe some of these things about yourself. And again, I do want to emphasize that care providers, they genuinely care and are trying to help. They're not intending to hurt people, and it can also be something that's really challenging and traumatic. So that kind of brought me 2003 to 2013. When I was 17, that was kind of my last inpatient admission at that age. That was kind of really against my will, and I went from an inpatient to kind of step down to a day hospital. And what really got me through it was knowing that, okay, after this, I'm going to be 18 and I can do what I want. I can be sick. For me, this was another interesting thing, and I think happens with a lot of people with eating disorders. You really identify with the illness, and it's something it's a sense of identity, and so it's hard at times. You may not want to get better. You may actually not be able to see the need to get better and to work towards healing. And so for me, it represented, I'll be 18, I can be free to be sick. And so at that point, then kind of began the next phase of my journey. And that was training and education. And so after that, 2013, I went off to university. I had the fortune to pursue my undergraduate degree at McMaster. And I really found that I was drawn to becoming involved. At first, I thought I want nothing to do with like eating disorders. I want to get away from it. And there was part of me as well, though, that was seeing like the system was so broken. I don't want other young people to have to go through that. And we need to change things. And so I was drawn to some different organizations that were advocating to really raise awareness about eating disorders. One was the National Initiative for Eating Disorders, or NEED. I had seen their founder speak, and I was really inspired by her. Her name is Wendy Presco, and her tireless championing of the cause. She herself has a daughter and speaks openly about how her adult daughter continues to struggle, and she really refused to give up hope that the state of the field could be improved. And through my involvement with NEED, they welcomed people to the cause, and I actually ended up then, I never talked about my illness or experiences with peers or others, but I shared my story. We went to Queen's Park and we were talking to members of provincial parliament, because we really wanted there to be more awareness about eating disorders and more funds directed towards research in this area and developing really effective treatments. And so that was the first time that I kind of came out about having struggled. And I think in some ways, I didn't deny it. It was just, it never came out. It wasn't something that I would share. It was something personal, and it informed kind of what I wanted to do. And it was also, again, this was my first time speaking about it. So I felt more anonymous, though, kind of going to the government, and then going back to my life. I was at school. I connected with like-minded individuals at school, and I joined a club, a great club on campus, which was called the McMaster Alliance for Body Peace, really focused on promoting body positivity. I volunteered with some different mental health groups. We had our student health education center, which was wonderful, and worked with the mental health committee. We had an online peer support chat, and there were also there was like an eating disorder specific peer support chat that I got involved in through this organization called the Looking Glass Foundation. And again, I was really drawn to focus on this area, and I didn't disclose my own history, but I used it to inform how I approached these roles for sure. I also, when I went away, I began to see how the illness itself was harming me, and it wasn't just that treatment was the enemy. The enemy was the illness, and it was hurting me. And so I began to see a therapist on my own, and that was a step that I took instead of being forced into treatment, and kind of taking ownership of that. And what really was powerful for me was that this therapist I began seeing had her own experiences, and so I felt really and truly understood. And we talked a lot about how she had encountered many barriers becoming a therapist and being someone who had struggles herself. And there was a tremendous amount of stigma in her training. She was advised many times that you can never tell people about this. Yet it just seemed so strange to me that the person who can probably best understand, I've been told over the years to do things or change things by somebody who really just doesn't get it. It's hard, but when there's that kind of deep sense of this person knows how challenging it can be to change some of those behaviors and challenge those thoughts, and they did it, and that's inspiring. And so that was something that really made a huge difference for me in my own healing journey. And it felt odd that in some spaces, for example, like Alcoholics Anonymous, like people will have a sponsor or somebody who's been through it who can then coach and really work with you, and there's this shared understanding. Yet in eating disorder treatment, in many other areas, it's really just something that's taboo. But that's to say, all of these experiences really solidified my passion for working in the field of mental health. I never thought that I would get into medicine, but when I did, and I was fairly sure it was too late for them to realize their mistake and kick me out, I pursued psychiatry. It made the most sense to me as a specialty. And I had lots of amazing experiences throughout medical school, which really reinforced that this was what I wanted to work in. Again, never sharing what had pushed me towards it, but it was such a huge part of every encounter that I had with patients. And it was really powerful when you, for example, are seeing someone and you need to make decisions around whether they need to be admitted involuntarily. And having been on the other side of that, you know how challenging it is. And it's something that you don't take lightly. And not to say that others do take it lightly, but it can be hard to understand really how powerless somebody can feel in that position. So I think I came towards the end of medical school. We were approaching the residency application process, and I was so set on psychiatry. I knew this was what I wanted to do with my life. And it was also challenging because a huge part of the residency application process is around explaining what it is that drew you to that field. And I had lots of things about it. Again, my love for stories, all the clinical experiences I had that reinforced that need. But that initial spark, that came from my own experiences. And I didn't feel like it was safe to discuss that or disclose that. Received explicit advice, in fact, that couldn't be done. People would say, not just with mental illness, but even with physical illness, like people would say, you can talk about how maybe your experiences with like a family member, that's acceptable to spur you into medicine. You can talk about some of those things, but you can't talk about yourself, and you can't be seen as weak or having struggled. And so I didn't feel I could be 100% genuine or authentic, and I was hiding part of myself. But nevertheless, I found actually through the application process, one of the things that really drew me to the University of Toronto's program in psychiatry was finding out that service users, people with lived experience, were heavily involved in the selection process. And that to me was really huge, and it was unique in they were valuing the perspectives of patients in selecting the next generation of psychiatrists. And that gave me a lot of hope. So it still felt taboo to talk about being a patient myself, but at least patients were valued. And I was thrilled to be able to join U of T's entering psychiatry residency program class in 2019, began my training, and here we are today. It's not 2021, my apologies, it's 2022 at this point. It's hard to believe how time has flown. And again, looking back at that journey, I mean, it's been almost 20 years since that first encounter in 2003. And one way of viewing my story is kind of as a winding, complicated, somewhat convoluted path from adversity to advocacy. And I'm now going to talk about one way of thinking about some of those steps along the way. As I noted, it began with adversity. We all have personal challenges, and while it can feel kind of patronizing at times to hear it, there's that sentiment of what doesn't kill you makes you stronger. And I hated hearing that many times, yet it has rung true for me, at least in some ways, that I desperately wish I could have avoided a lot of what happened while I was going through treatment and the mental health system. But I definitely would not be in the position that I am today without having faced those challenges. And part of the growth that I've experienced is due to having tried to make some meaning out of what happened and to try to take as much away from it as I can from what took place. To be honest, it's been difficult at times really to shift from a mindset of being bitter about what happened. And a piece of advice which has really stayed with me is that holding on to anger is like drinking poison and expecting the other person to die. So, I mean, I've tried to remind myself that the providers that I encountered along the way, they were doing their best. People were doing their best, and they didn't have ill intentions. They were trying to help, and just maybe not knowing the best way to help. So slowly letting go of that anger and channeling it into striving for change has really helped me develop a sense of purpose. It continues to provide a sense of meaning in my life. Kind of the next step was then identifying areas to target based on what I had learned. And there are a few key takeaways related to kind of eating disorders specifically, which I'll touch on shortly, but these can also be applied more broadly to the mental health system as a whole. And I saw infiltrating the system as the best way to accomplish these goals, or to frame it another way. It's difficult to elicit change from an external position. But collaborating then with those already working in this area, becoming part of the system in order to help change it, it seemed to me like that was a more likely to lead to lasting, sustainable change. It would also give insight into what are those current challenges and barriers that have been preventing change thus far. It's putting kind of external pressure without appreciating those nuances can be tough. So that's kind of how I've arrived now at this advocacy stage. And it's a privilege to be able to leverage my position of power now in this way, being a psychiatry trainee and a future healthcare provider. And I hope to be able to really continue to do so, and I still feel quite nervous at times about disclosing things. This is really quite a recent step for me. And the past few months in particular have highlighted the value that it can have, despite being afraid of kind of professional ramifications or consequences and the stigma. But I've had a really positive experience thus far. And then sharing my story and having people then reach out, patients and their families, and sharing their own stories, and that this makes them feel like it's okay to share, It's been eye-opening. It's validated my experiences and validated the need to do this work, and solidified my determination to really continue along this path. So one of the major challenges, though, has been reframing adversity. and trying to combat that stigma that comes with having been a patient myself. Being sick is often seen as a weakness, a flaw, something that's just inconceivable in someone who is really supposed to be providing care to others. Yet, I firmly disagree. I think that my own experiences have really helped me empathize with what patients and their families may be feeling to a greater degree than if I had not been on kind of the other side myself. Of course, it's never possible to completely understand someone else's experience. I can appreciate, as I mentioned, like how frightening it can be to seek help, to be hospitalized against one's will, to develop a sense of mistrust in the system. And keeping all this in mind really makes me consider carefully the steps that I do take. Although I don't share my story or background openly with patients, just out of the blue, when they do have the same diagnosis or even not the same diagnosis, but there are commonalities among various mental illnesses in terms of some of those driving forces, those root causes, perpetuating factors. I feel better able to really address some of them, having encountered some of them myself. And examples of this have emerged over the course of my training and during electives, during rotations, child and adolescent psychiatry in particular. I had done my child and adolescent rotation at a hospital, and during the pandemic, seeing a surge in eating disorders and suicide attempts among young people. It's really, I felt deeply connected to them, and it's been really heartbreaking, but also I think it's something that with which I do have some experience. And over time, I've encountered more and more people who do describe their own paths into medicine and the mental health field. And I realized it's more common for people to take that journey from patient to provider and to be driven to this work by their own struggles, despite it not being talked about openly. I am, though, having more and more conversations with colleagues and about how it is something that drove them to it, and speaking about it a little bit more freely. So there's progress. And although there's still some degree like a hierarchy of acceptable illnesses, physical illness being perhaps more acceptable than mental health disorders, and mental health disorders often being invisible or easier to hide, but also perhaps more stigmatized, and certain mental illnesses stigmatized to an even greater degree due to perceptions that they may be a lifestyle choice or under greater control for someone. So I think addictions fall into that, as do eating disorders. This quote from a TED Talk is something that really, it may have once been viewed as radical, but I think it's increasingly being accepted in society and in the medical community. We need to see people who have lived through a particular experience as the expert on their issue. The person who spoke this went on to say, we need to think about how to give power to those who have faced stigma, to take leadership on those same issues, to think about how to help them, help others in situations that have affected them so significantly. Otherwise, the people who talk the most and make the decisions will too often be people without firsthand experience of the topic. And there's been a definite shift towards this in the medical culture, as I've noted, recognizing, appreciating, highlighting patient voices. Those with lived experience are finally being invited to sit at decision-making tables. And there's been great examples of this at the Canadian Medical Association, their annual conference. There was a huge drive to have people, not just physicians and medical trainees, but to have patients be able to attend and provide their perspectives. And I think patient advisory councils are being developed. There's more and more happening to really encourage this. I see somebody's asking to show the first quote. Definitely can go back to it. It's a very powerful statement and so true. And I guess thinking now, how have my own experiences helped me to identify areas for change in the healthcare system, and what are some of those changes that I'd like to see? And how is it going to inform my approach to psychiatry moving forward? One thing for eating disorders, there's minimal education. They remain poorly understood, little coverage during medical training, and that probably contributes to the discomfort that many clinicians feel with diagnosing and treating these illnesses. As a result, many individuals are dismissed for maybe not appearing to meet the stereotypical portrayal of an eating disorder patient, while others are forced into treatments which may not be helpful or consider their unique situations and needs. So tailoring treatments to the individual in place of a one-size-fits-all approach is one much needed change I'd love to see. The system also currently really focuses on symptoms, treating symptoms such as the refusing to eat, the losing weight, which is needed to make sure people are healthy, and also doesn't adequately address those underlying issues which can manifest in those. So I think, again, when I was 7, I wasn't concerned about body image at that time. In my case, I was highly anxious. I experienced events which made me feel powerless, perhaps, and somehow came to maybe see control over my food intake as a coping mechanism. And then maybe trying to strip me of that coping mechanism without recognizing that it served a purpose, made me maybe cling tighter to it rather than curing me. And so, well, I recognize it's vital, again, to address some of those physical concerns and ensure medical stability, more of an emphasis on healing one's relationship with the body and exploring the underlying issues would be really beneficial. And while current approaches do include elements of therapy, the emphasis seems to remain on nutritional piece. Then one more area is this need for innovation. A sentiment that really resonates with me is the futility of doing the same thing over and over again and expecting different results. And it's clear that while some people do improve and recover within the current system, it's failing to meet the needs of a significant proportion of patients. Patients are not failing treatment. Treatment is failing patients. And so investing time, energy, and resources in developing unique and innovative approaches will be vital moving forward. And advocacy is how I hope to get there. So some of the ways that I've had the fortune of engaging in advocacy, kind of formally and informally, there's been volunteer work, creative writing, speaking up, and some of my professional pursuits. So in terms of volunteering, I mentioned some of those different organizations and being connected to others and with similar backgrounds. That's been a really great way to kind of channel my passion into engaging some of this advocacy work. Creative writing is something, I'm by no means a talented writer or author, but it's something during my undergraduate studies, and then I continued to explore. It was kind of an outlet to write about my experiences, and I began to share things with small groups of people that I felt safe with, but it helps me put words to my experience and express myself in ways that I never would have felt comfortable doing so before. So in addition to that, more recently, again, this has been something that's been kind of scary, but very rewarding, is speaking up. I recently had the opportunity to talk to CTV News and share my story. And again, the support that I've received with this has been really, really heartening, and also shown me that it's important and something I want to continue to do, to show people that it's possible to go from being a patient to a provider and to give hope in that sense. I also then have my professional pursuits. I have privilege of working with a great team. We make podcast episodes, and so I really wanted to do an episode focused on eating disorders and making sure that we have good education on that. I have research interests in kind of finding new approaches to eating disorders, and also really wanting, as was noted with my bio at the beginning, to focus on this and focus my career towards this eventually. So that kind of brings me towards the end here, but really, how can we open the healthcare system to more patient voices, which is so, so important, and not just as patients, kind of being aware of this, but patients and providers, and that there is no us and them. We are all human. We can all be both patients and providers at different times in our lives. And we can really achieve this by involving patients and their families in the development of training for providers in the co-design and implementation of treatment programs, the development of research. And our ultimate goal is to really improve the care we can provide, because again, we're not asking the experts, what are we doing? So the wealth of insight that patients can bring to the table is crucial. And my hope is that this will also facilitate trust and connection and bridge the gap between us and them. So what can we do to improve that representation? I would really encourage those in the position to do so to advocate at an individual and a systems level, openly discussing these topics with your own healthcare providers, with seeking out opportunities to add your voice to the conversation on a broader level will hopefully lead to greater acceptance and meaningful representation. And those with lived experience and a passion for improving the system can seek out training and careers within healthcare. It's hard to address some of those issues in the system, as I mentioned, from the outside, and working from the inside provides opportunities to deepen our understanding of the challenges and to collaborate with others who are similarly driven to strive for change. So ultimately, I hope that those who are hearing this will feel less alone and feel empowered, and significant efforts are being made to raise awareness about mental illness, but stigma does remain and can lead to feelings of shame and hopelessness. We're not weak though, because we've struggled, and the challenges we faced, the experiences we've had really shape our path and can make us stronger. And I believe that there are so many resilient, courageous individuals out there with their own stories to share who have so much to offer the healthcare system. So I think I'll wrap up there. And at this point, yeah, I would welcome any questions, and also feel free to reach out at any time. Thank you so much.
Thank you, Nikita, so much for sharing your story with us. And yeah, anyone who has any questions, please put them in the Q&A box, and we'll get started on those. Nikita, our first question from an audience member. When I dealt with disordered eating, it felt like my best friend, something that gave me a feeling of safety and control. Do you have suggestions for how to replace that feeling when searching for different coping mechanisms?
That is a really, really excellent question. And yeah, kind of, we need to find other ways to achieve what an eating disorder may be doing for us if we're going to kind of try to move past it and to heal. Some of the things that I worked over the years with therapists to focus on was, how do you feel, again, safe and without feeling that need to kind of engage in those behaviors. So finding, for me personally, I've felt more safe with my body by doing things that really make me appreciate kind of what my body can do for me beyond what it kind of looks like. And so really focusing on trying to feel kind of strong, and yoga is something that's, for me, been a really, really wonderful way to kind of, it's like, it's not so much about what your body looks like, but it's how your body feels, and then being reassured by that it's something that your body becomes not an enemy or something to change or try to fit into a certain mold, but it becomes, it's you. And so that's something that I found helpful. I think finding other pursuits, I mean, sometimes like perfectionistic tendencies can play a huge role. And so trying to be more flexible with that, and also doing different things, like, again, with like artwork, like there are things where there's like a degree sometimes of really trying to make things appear in a certain way. And so sometimes that can be helpful. I think the idea of balance is always welcome. So it's maybe being okay with things not being perfect, and also acknowledging that we may have those urges, and that that's not, it doesn't make us wrong or bad, and seeing how we can kind of, again, achieve balance with it. I hope that helps a little bit. Oh, I think, Ben, you're muted.
Sorry about that. Thanks, Nikita, for answering that first question. Our next question, they say, thank you for sharing your experience. In your opinion, what could someone with lived experience do to reframe their adversity and move on to become an advocate for better mental health services?
Again, great question. So people with lived experience, I think we all have our own unique circumstances, and kind of seeing whether it is something that you feel like you have the capacity to take on. There's advocacy on many different levels. There's an individual level, kind of a community level, systems level. So there are ways, if you feel comfortable sharing things openly and you have the capacity to do so, again, going to like the government, members of parliament, sharing your stories, advocating for change in that way. Kind of taking a look at things and seeing if there's different organizations you can get involved in and who are striving for change as well. And I think one of the key things for me has been connecting with others who have been in similar situations. And really that's helped me to personally see that it is something. Sometimes you can see it more in others than yourself, that it's strength. And so there's challenges, and also that it's something that we collectively may have experienced, and then we can then work together to advocate. It's hard to do this work alone. It definitely, I never would have been able to do that. So connecting with and building a sense of community can be really key in doing that reframing and then taking that next step.
Our next question, in your opinion, what are the best treatments for eating disorders, and what did you find helped you the most?
Again, this is challenging because everyone has very different experiences, and again, it's like a one size fits all that approach. What we really need is to customize things to an individual situation. And like somebody with, for example, a substance use disorder and an eating disorder may be more similar in what helps than two people with an eating disorder. And personally, like things that I've found helpful for me was finding, again, a therapist that I could really connect to, and just really trying to explore what it was that was driving some of these behaviors and what I could then replace it with in order to, again, it was helping me to do something and cope with something. And so how can I kind of achieve that in more healthy ways moving forward?
What do you feel that the people around you, such as your parents, family, and relatives, did right in supporting you through those difficult periods?
Yeah, so I think one of the things that was very challenging was a lot of our relationship was quite conflictual when I was going through like the child and adolescent system, because kind of the model of treatment, family-based treatment, it very much set up that the parents and family take over kind of providing like the food and feeding. And so I became very angry with them. And something that's been really helpful, kind of moving past that, is this openness to just be there for support. And again, it's challenging when somebody is a child and you do have a responsibility to take care of them and ensure that they are staying alive and medically, and kind of becoming an adult and allowing me to take ownership of it, yet providing a non-judgmental ear to listen to, offering that support and letting me know that they're there when I'm ready, and that I do have that space to talk about things without forcing me into doing things that I'm not comfortable with, has been really helpful kind of as I moved into taking more autonomy and ownership of it myself.
Our next question. Pediatric in-person treatment currently doesn't allow any other concurrent therapies until the patient is deemed physically stable. Do you think that this approach is too rigid?
And I think there's been kind of research done, and I think where they're coming from with that approach is that you often hear that the brain is malnourished and you can't engage in the therapeutic work, and at the lower your weight is and the more you're suffering malnutrition, the less likely it is that there's going to be any kind of, I guess, dents made in your thinking. And so to some degree, I can appreciate that. And I'm by no means an expert on this. There are people with many, I'm an expert on my own experience, and there are people who have studied this. And I think that personally, I do feel that it may be a bit rigid. I think it's always maybe worth exploring and trying to get into some of those underlying concerns and issues. Yet I definitely I want to focus again on working with people, and there may not be a best like a one answer, but it really would depend on the patient and where they're at. Somebody may be extremely underweight, yet also capable of making some of those shifts in their thinking, perhaps. So I do hope that more flexibility is always going to be something that we look towards.
Thank you, Nikita. Our next question, do you have any advice for navigating positive reinforcement for losing weight that someone with an eating disorder might receive?
Yeah, I think that in our current society, it's definitely something, it's a huge issue. And so again, it can really lead to it being hard to try to see the need to get help or the need to change things when you're receiving messages that this is a good thing or it's not being recognized as something that's maybe harming rather than helping you. And I think that something that I mean, being if you're willing to kind of talk about the struggles with somebody like a trusted individual and let them in on this and that you are struggling, getting into kind of treatments or finding a therapist that you can talk about it with who will kind of give you a bit of a reality check and let you know that it is at the end of the day, if you're distressed and you're struggling and it, I mean, hearing that other people think they don't know what's going on inside for you. And so having somebody that you can trust and share that with, and then they'll keep you kind of on board with what your goals are and wanting to live in alignment with your goals. And perhaps there is positive reinforcement, and also there are things that are not going so well.
One thing you mentioned in your talk was that you found it very helpful when you started working with a therapist who you really clicked with. Do you have any advice for people who are looking for a therapist on how to find that kind of match?
I think something for me that helped was realizing that once you start seeing a therapist, and it can be challenging again in our current system, it's so hard to find accessible therapy that can be kind of affordable. And so when you find a therapist, it's almost, I can't let go of this. And doing therapy just kind of for the sake of it, and if you're not feeling that sense of connection, there's lots of kind of research showing that the most important thing is that therapeutic relationship, kind of regardless of what modality of therapy you're doing, whether it's CBT or dialectical behavior therapy. There's all these different forms. And at the end of the day, the key thing is really that alliance with the therapist that you form. So I think not being afraid, if it's not working, you're not feeling that fit, to find another person who you do connect with more deeply. I think that's something that can be helpful. Again, I'm hoping that we can work to change the system so it becomes easier for people to really find those resources.
If someone is in a position where they're a patient and are receiving treatment and they want to be able to successfully advocate for themselves, do you have any particular advice on the best way for them to approach that?
Advocating for oneself, it can be really, really difficult, especially as we know people with illness can be seen as weak and not as the experts. And so knowing this is what I need for myself to get better, I think trying to identify people like on your healthcare provider team. They do want to help you. And so sharing openly, I think this maybe isn't working for me, and trying to really work collaboratively to help them understand your experience. Again, it can be really hard to do that alone. So trying to draw support when you can, if you feel comfortable, from friends and family, and using that to advocate. But it's a challenge, and I'm hoping that as we continue to really highlight that people are the experts on their own experiences, that providers will be more open and receptive to this idea. And there seems to be a shift already.
Well, Nikita, thank you so much for taking the time to join us today, and for sharing your story, and for all the advocacy work that you've done and continue to do.
It's been such an honor to be here, and thank you so much again for the opportunity, and it's a privilege to speak to you all. Thank you.
So we'll be proceeding with our exhibitor fair shortly. We've got some representatives from a few different mental health organizations who will be speaking to you. We'll just begin that in a couple of minutes as we get everyone set up. So please stick around and join us for that.